All I wanna do is this. Motherfucker don't know. Need the real in this bitch. Niggas like to go low, but they can't get with this. Nigga trying to make money, starting off real hard. Nigga couldn't even go. Wanna know what's the show? Need the real on the mic. YouTube streets in the night. Doing all that he could. Nigga gon' keep it hood. But the haters won't top me. Motherfuckers won't block me. Assholes gon' flag me. Motherfuckers can't stop me. Hating ass niggas everywhere. Jealous niggas wanna sit and stare. Need the real, better be aware. Hating niggas better be aware. Hating ass niggas everywhere. Jealous niggas better sit and stare. Need the real, better be aware. Hating niggas better be aware. Need the real getting lit, yo. Need the real like FICO. Need the real score higher than a 7-800. That's not a typo. Need the real on horizon. China road is higher. Troller trying to play me. They a motherfucking liar. AFW on a corner. Can't depend on honor. She recruited another set. Now she is a wretch. Lame niggas in another space. Seeing dollar signs in this place. Good guys gon' protect the place. Trying to keep the fucking haters away. Hating ass niggas everywhere. Jealous niggas wanna sit and stare. Need the real, better be aware. Hating niggas better be aware. Hating ass niggas everywhere. Jealous niggas better sit and stare. Need the real, better be aware. Hating niggas better be aware. Hating ass niggas everywhere. Jealous niggas wanna sit and stare. Need the real, better be aware. Hating niggas better be aware. Hating ass niggas everywhere. Jealous niggas better sit and stare. Need the real, better be aware. Hating niggas better be aware. Welcome, everybody. This is D. Durrell with the Conscious Clientele. I am broadcasting from D. Durrell Life Solutions. I'm also broadcasting from D. Durrell The Rebirth and the Black Balance Network. First and foremost, I'd like to give a shout out to the first person that's basically in the chat, Red Pill Finance. Shout out to you, brother. Appreciate you for coming in today. Today, I'm going to be in my therapist mode today. I am going to educate and present a clear-cut definition of pedophilic disorder, which is AKA known in layman's terms as pedophiles, but the clinical term is pedophilic disorder. Also, I'm going to talk about the fact that it is as far as it's the ins and outs of it, as far as the symptomology, diagnoses, treatment, prevalence, medication treatment, and also focusing on the family of disorders, such as paraphilic disorders, which is the family that consists of that's the overall grouping for the term pedophilic disorder. Now, when I'm talking about paraphilic behavior, paraphilic disorders, what we're focusing on, okay, this is deviant behavior. Okay, this is deviant behavior. It's a condition that's characterized by abnormal sexual desires, particularly adults, as it involves extreme and dangerous activity, and in many situations, as it deals with pedophilic disorder, it involves children. It involves 12, 13 years old and younger. Okay. Now, for those that don't know and are coming in and tuning in, and appreciate the 8 people that have come in for this particular topic, some may be asking, well, D. Durrell, why are you talking about this particular topic? What has driven you to focus on something such as paraphilic behavior, such as the topic of pedophile? And I understand in this sector, we don't like using that word, but because I'm speaking today and presenting from a clinical perspective, if anything gets struck or it's a trigger word, I will definitely let YouTube know for educational and professional purposes that the use of this video for those that want to use it for whatever reasons is strictly from an educational and from a clinical perspective of myself being a clinician. Now, we have understood, well, it is understood that in the YouTube space, social media and abroad, people have utilized social media in many ways. And when we're talking about paraphilic behavior is rampant among social media, YouTube, Facebook, Instagram. A lot of the deviant behaviors that are listed in this family of this sexual disorders, they're exhibited amongst the social media community. There are people who are engaging in frauduristic disorder, which is basically rubbing against and having urges to touch and rub against other people. Sexual machismo, masochism, sexual sadism, hurting others for sexual gratification. Fetishistic disorder, fetishizing others, objects, people, certain types of characteristics about themselves being fetishized. Transvestic disorder, and yes, that is a disorder. Intense urges for cross-dressing, fantasies, urges of behaviors. Doing things of the opposite sex. See, paraphilic disorders deals with things that are outside of the normal range. Since we want to talk about pathology, this type of pathology is orientated around doing things outside of the normal range within this culture, primarily adults. And in many ways, they engage in dangerous behaviors that put themselves at risk and other people at risk. Now, for me, I don't focus a lot on the perpetrator, even though I will be once I complete and get accredited. Because in domestic violence, that you do hear a little bit of that, and every now and then I get a sexual deviant client, particularly my CPS cases. Okay, but this is not an area that I focus on a lot in my practice. So today I felt it was an incumbent upon me as a mental health professional to give a comprehensive explanation of why we are encountering people who are interacting in pedophilic behavior. So I felt that it would be necessary for me to educate you on what pedophilic disorder means. Appreciate those coming in. V-Dub Boogie, what's up? Be More Legends, what's up? And Al's Gate Trainer, he said it's binary code. What's up, player? What's up? Appreciate you all for coming in.
So let's get to it. So I just wanted to give a little summary of that to let you know where I'm coming from, where the texture of this presentation is suited, because this is sexually deviant behavior. And it's unfortunate that there are people in these spaces who are protecting and supporting, such as Edward Anderson and others, people who engage in paraphilic behavior. For those that don't know the people that's on the thumbnail, look it up. Their name speaks for themselves. Now, I'm not going to use the term pedophile a lot. I'm going to use the term pedophilic disorder. I'm not diagnosing anybody with anything because nobody in here is my client, so don't ask me. Don't ask me. If anybody asks questions, don't ask me, do I think somebody has pedophilic disorder? I'm going to tell you I don't know. I'm not going to answer the question. They're not my therapist. This is only used for educational purposes. Today's panel is closed. This is a presentation. I will not involve any panelists for my own protection so that nobody asks me questions that could be deemed as unethical if I answer. Now, I want you all to understand, as we focus on pedophilic disorder, in layman's term, pedophile is what we consider pedophiles. There's three things that we must assess in the diagnostic criteria for this type of illness. Number one, we have to look at the time frame in which the behavior and the age of the child. And I'm going to talk further about that. Number two, the acting out of the sexual urges, how they were acted out, the intensity of it, and as far as it being marked by distress or impersonal issues within for doing it. And lastly, diagnose the age in which the person can be qualified for this diagnosis. The diagnosis applies to people who are 16 years of age and older. There has to be a limitation somewhere. So let's get to it. For one, we're going to look at time frame. The time frame of the behavior and the age of the child. Now, we must understand that in most mental illnesses, but particularly in this family, in the paraphilic family of disorders, one must engage in these behaviors for at least 6 months, for the most part. Not 3 months, not 4 months. But in the accumulation of the data, it's very important that we look at time frames in which the behavior is displayed, in which it is being exhibited. And in terms of the way the behavior is being exhibited, we have to look at the intensity, how recurrent it is, the arousal, and also the age of the child that is being victimized. So, and as it relates to time frame, we're looking at over a period of 6 months in which there's intense sexual urges and fantasies, behaviors involving sexual activity with a pre-adolescent child, meaning this child is under the age of 13 years of age. Okay? So number one, you have to look at how recurrent it is, how intense it is, sexual fantasies, urges. The behavior has to involve a child that is barely a teenager in all intents and purposes, 13 years or younger. This is not hard to decipher for any adult male. Adult men and women although the majority of people diagnosed with this disorder are men, they are targeting people who have pedophilic disorder, target young kids. They target kids on average 13 years and younger. But then we're going to say, well, D. Durrell, what about those if you're 25 and you're targeting a child, somebody that's 15, 16, 17? That is still looked upon as being a sexual deviant. It just doesn't qualify for this type of disorder. Unfortunately, they have to do an age cutoff range, and they chose the DSM members, people who are a part of this committee, chose to disconnect at the age of 13. In my position, I think that it should be anybody 17 years or younger, from my position. But again, I can't allow my personal biasness to get in the way of DSM criteria, because that's the criteria. So if that was a person that's 35 that had sex with a 15-year-old, I could not necessarily say that they were a pedophile or they have pedophilic disorder. However, there is a legal terminology that if the legal system chooses to use that word, or they use the term sex offender or sexual deviant and so forth, then that's going to be the label that will be applied. But from a diagnostic, psychological terminology and so forth, an adult that's having sex with someone older the age of 13 would not necessarily be diagnosed with this disorder, but I'm pretty sure they may have other things that may run comorbid to what they're doing, but they will be labeled a sex offender and they will be put on a sex offender registry. It just doesn't meet the criteria. Those are two different things. Next thing that we want to look at is acting out of the sexual urges, because that's what's being observable. That is what we as clinicians can document. Okay. And basically, in acting out the sexual urges, we're looking at the fact that an individual is acting out these urges or fantasies marked by distress and interpersonal difficulty, meaning that this person, even though they're acting out these urges or these fantasies, is marked by some type of psychological uncomfortability. There's some type of psychological distress, anxiety, depression, irritation, frustration, some type of inadequacies followed by it. The behavior itself does not provide a relief. It can actually compound the situation in which a person may recurrently do the behavior again. What's up, Grandmaster Troll? What's up, brother? I appreciate you for coming in. If you have any questions, let me know. So when acting out the sexual act itself, it doesn't necessarily resolve anything, because this person, due to the sickness of them psychologically, are unfulfilled. They're unfulfilled. Therefore, they want to do it again. And it causes interpersonal difficulty within themselves and other people. Within themselves for what they're doing. A sense of inadequacy, a sense of social dysfunction. That's why a lot of people engaging in behavior don't have a lot of friends and family. They don't have dates. A lot of people like this don't have proper interaction with adults. Look around at what you see in YouTube. Look at what you view from people who have been pointed out for acting out in this manner. These are people who have done and have said some of the most outlandish things and have gotten away with it. And more than that, there are people who support them. You had a guy saying that if a 13-year-old has a period, 12-year-old, that is no longer a girl, it's a woman. You had a female out here who was giving alcohol and going on dates with a former student at Mr. Glendon, having sex with an adult woman and her daughters. And we don't know how young he decided to satisfy his quote-unquote appetite. His appetite. You see, this is DSM criteria. So don't try to argue and say, well, D. Durrell, you're saying, no. I am giving the exact verbatim information referenced by the DSM-5. This is not D. Durrell saying things. This is me clinically speaking, but I'm speaking to the YouTube universe. These are facts. Next thing I want you to understand is that as far as criteria, again, we got to look at time frame. We have to look at intensity of urges, and we have to look at the age range. A person, in order to be diagnosed with pedophilic disorder or be labeled a pedophile from a clinical standpoint, not from a social standpoint. Clinical and social are two different things. But in reference to a clinical standpoint, it is highlighted at the age of at least 16 years of age, or at least, and let me say the key word, and at least 5 years older than the child or children. And you have to do this for 6 months. So that means a 17-year-old has no business having sex with a 12 or 11-year-old. A 16-year-old has no business having sex with a 10-year-old or 11-year-old. A 18-year-old has no business being with a 13 or 14-year-old or 11-year-old. As you listen to the spaces, many conflated the differences in age versus the age range. How old you are from the person you're having sex with. R. Kelly was in his 30s and 20s having sex with kids 14 and 15 and attempted to marry one at that age. This is pedophilic behavior. Also, in the three features that I just talked about, as it relates to time frame, acting out of the sexual business or urges, and the diagnosis, one must have all three. Because usually they all kind of coincide with one another. So the chances are, if you're doing one, you're doing the other. And you're engaging in all three. So we must understand this. Minimum, at least, they're all sex offenders. People who engage in these behaviors are sex offenders. DSM criteria, most of them are considered diagnosed with pedophilic disorder. aka a pedophile. We have to look at the fact that people who, if they're exclusively attracted to children, or whether or not they're non-exclusively attracted to children. We also have to specify if a person is male or female who's attracted to males. In many cases, it's males being attracted to males. There's males being attracted to females. Or the person of age is attracted to both males and females. One other caveat that I must identify is that incest is also a situation that can be involved, that a person with pedophilic behavior may involve in. Matter of fact, in thinking about this, one of my oldest, not an oldest, but one of my last situations of far as cases of treating someone with this illness, it involved incest with a cousin and a sister. He was almost an adult, 17, and he engaged in having fantasies and urges and acting out of sexual behavior or attempting to do things in a sexual manner. Now, I want you all to understand that in the conquest of the perpetrator, it doesn't necessarily involve penetration. It can involve fondling, inappropriate touching, kissing, hugging, exposing of oneself, which is to me one of the largest indicators of pedophilic disorder, and also an overwhelming majority of people who are labeled as a sex offender, they have engaged in some type of genital exposure to kids of any sex, male or female. All of these behaviors that I'm describing is outside of a normal range for a human being and within this culture. And it is punishable by law. That's why it's listed that as far as paraphilic disorders in itself, as it relates to pedophilic being one of them, dangerous behaviors. Because it's not just dangerous for the person, particularly being criminalized for it, but it's also harmful to the victim. Now, pedophilic disorder is not a illness that basically has a lot of. It only has 3, and most of the illnesses in the pedophilic family have about 3 or more characteristics. In other disorders, they have 4 or more. It could be anywhere between 8 to 12, 10 to 12, and you have to have a certain amount of features in order to qualify for that disorder. So it's only 3. But the fact that these 3, as I spoken about, dealing with the period of time that they had these urges, the intensity, and is it marked by distress or interpersonal issues? And lastly, you got to be at least 16 years of age and with someone that's at least 5 years older, than the person that you're attempting to have sex with or engaging in sexual activity. This is facts. This is not D. Durrell throwing something out of his butt. But as we look at this, guys, we have to focus on the fact that we're talking about grown adults that engage in these behaviors in their late 20s, 30s, and so on. This was not someone as a teenager. These are grown people that were doing this. This is grown men and also women. And I understand that the majority of people who are diagnosed with pedophilic disorder are mostly going to be men. But in this space, we had women too. So there's an incumbent upon me to be as balanced as possible as we focus on men and women who engage in these types of behaviors. They all need to be equally punished and ostracized from this community. So I'm going to now talk about the clinical treatment aspects, as I talked about the diagnoses. Now it's time to talk about clinically how to treat it. There's another side of it. We can point out, we can identify the negative behavior, the horrific behavior that these people engage in with kids. But they have to be treated. They have to undergo analyses because we want to prevent and understand this behavior in order to reduce the occurrence in our society. And again, I want to point out as we deal with paraphilia, which is the family or conditions, as we speak of undesirable or abnormal sexual desires that involve extreme dangerous activities and behaviors. It is extreme for a 22-year-old man to be sexually involved or fantasizing or having urges with a 12 or 13-year-old child. Facts. Now we want to look at the causes. We talk about the symptoms. I already talked about the symptoms. I've already spoken on the diagnosis. Now the causes. Most people who engage in these behaviors went through some type of childhood trauma, such as sexual abuse, or let's say that they are also the fact that many people may engage in behaviors because of some type of social phenomenon that occurred while they were a child. Something they were maybe socialized to do by other adults, being exposed to seeing or viewing other things such as porn, someone having sex, or seeing things repetitively. When kids get exposed to sex, whether they're experiencing it or viewing it, it can have a effect on you. It can have a psychological effect. And in that psychological effect, a person gets old enough and they are somewhat curious about sex. Kids internalize that behavior, and then they can perpetrate that behavior on another person. That's what Mr. Robert Kelly did. And that's why when they talk about that to him, his understanding of what's inappropriate is not of the understanding of a person at his age or any adult, because his mindset has been traumatized as a child when he was first treated in this manner. as we on sex, and we're going to focus on how eliminating this behavior from their lifestyle. As we look at cognitive behavioral therapy or other cognitive or behavioral like treatments, particularly when I first began treating people who had pedophilic disorder, I was in an internship about 18 years ago. Matter of fact, it was about 19 years ago, in which I surfaced and provided services for adolescents who engaged in this type of behavior with their family members. Most of them were family members. This is a group home full of boys. And they all engaged in victimizing people who were close to them, particularly family members. And they did it repetitively. Until they were held accountable by the judicial system. These people need to be held accountable for their behavior, because if their behavior if they're not held accountable, it can only intensify. And the arrogance, such as one like Robert Kelly, as he got older, he became more arrogant because he never thought that he would be held accountable for his behavior, for all of the heinous crimes that he committed against women. And so these are facts. So as I talked about that, we're talking about treatment. Also the fact that you also can treat pedophilic behavior with medications that can in some way minimize the impulsivity of wanting to engage into that behavior. Again, this is not a cure. This is treatment to minimize the behavior. Also, I want to find out as far as risk factors. We find that the brain activity of sexual arousal, that there's a difference. We've also, as mental health professionals, found that men who engage in pedophilic behavior also have lower IQ scores, and their psychological testing, they perform a lot lower. On average, not saying all the time, but on average. And as we all know, R. Kelly had learning issues, disabilities. That's also another guy that I had issues. I'm not going to say his name, but he's been excommunicated out of this sector. He also was diagnosed with, I think, an intellectual deficient disorder or a developmental disorder. And he did not perform well in school. So we have to account for that the existence of this, that correlation. Because it is apparent and it is visual, and it has to be identified and studied. I also want to point out, guys, that 12% of males have these type of issues as opposed to 4% of females. That's only what's being observed and reported. Those numbers could be bigger than that, but those are the estimates based on what's being reported. Now, I can talk about the other disorders, but I'm not going to focus on transvestitism and these other different illnesses and so forth, because there's others, voyeurism and exhibitionism. I'm not going to focus on those. I want to focus on those as it relates to this sector and the people in this sector and those that are being criminalized and people who are getting away with this type of behavior. That is my focus today. Not necessarily on the family of paraphilic disorders, just on that one specific. If I choose that it's appropriate and beneficial for me to talk about the others, I will do so at the appropriate time. So, guys, in summary, that is basically what makes up this disorder. If anybody has any questions, I'm going to give 2 minutes. Give anybody 2 or 3 minutes to raise any questions that you ask about pedophilic behavior or pedophiles as it relates to this community or in the Black community, and I'd be more than welcome to answer those questions. So if anybody has questions, let's go ahead and bring them out now so I can answer those questions. And so I'm going to go ahead and go on a little bit more. So my experience, again, when I began my internship, I began actually treating these types of clients. They were all teenagers. They were not adults. It wasn't until maybe a few years later I began providing services for adults who had pedophilic behaviors or diagnosed as pedophiles. And every last client that I had that engaged in these behaviors, they were diagnosed with other mental illness. Many of them had schizophrenia, schizoaffective disorder, they were bipolar, or they had depression, or they had anxiety issues, they had PTSD, they had substance abuse issues. Honeybee asks, is it learned behavior or something different? For the most part, pedophilic behavior is behaviors that is not necessarily learned, but it's associated a lot with childhood trauma, or the fact that it's something that you modeled, or in some ways it's a little bit of both. It's something that can be somewhat biological as it relates to your brain arousal towards certain objects and situations. And it also relates to you from a social standpoint, experiencing childhood trauma or being exposed to sexual activity as a child. And it basically influences your perspective of sex and how you will go about practicing it as an adult. Good question. So Dee Dee says, what are the best practices and treatment approaches? Thank you. The best practices and approaches for treating pedophilic type behaviors is cognitive behavioral therapy, or I would say dialectic, any type of cognitive therapies, primarily cognitive behavioral therapy. And I don't want to just highlight that one, but that seems to be the most effective. I also think that curriculum-based therapies that focuses on a pedophile following a curriculum of exercises and treatment and ongoing interaction, not only in group or individual therapy, to me can present behavioral change and allow that person to minimize their ability or in some way extinguish this type of behavior long term. Now, by no means is it a cure. I also think that aversion therapy which is something I saw, which they use aversion type therapy to basically provide an environment in which the perpetrator is uncomfortable with seeing or hearing the fact of what they were doing, or put them in a position where they had to express what they did to provoke some type of feelings of being uncomfortable and guilt for the fact that they acted in this manner to another person. So first of all, I would say cognitive behavioral therapy or any other form of variation of cognitive therapies. Okay. Number two, I would look at curriculum-based therapies. I've done a little bit of both curriculum-based therapies that follow a step-by-step curriculum. Psychoeducation is also good, and educating them, they can also be curriculum-based. Also, the fact that we can never dismiss the uses of medications to lower those inhibitions and those urges and the impulsivity of the thoughts. That's a good question also. Honeybee says, is that why domestic violence is so high because of this, based on your expertise, based on sexual confusion or sickness of the mind? Domestic violence, there's many factors that can contribute to that. I'm not going to necessarily highlight it to one, but most people who engage in domestic violence, particularly the perpetrators, many of them have either been physically or sexually abused, or they witnessed their father or mother engaging in that same behavior. Also, the fact of the matter is that many individuals who engage in domestic violence also have issues functioning in relationships and may have comorbidity to other mood or affect disorders that affect how they manage and behave, manage their mood and behavior, particularly when they are engaging in some type of conflict with someone else. Black Bearded Nerd says, how often do you do these behaviors? How often do you blank these behaviors in our community as opposed to other communities? I pretty much see these type of behaviors just as equal or not more in other communities. In my experience, I have seen pedophilic behavior probably more in the Hispanic community and rural white communities, and then I've seen the Black community like third, for the most part. Now, I'm not quoting no exact statistics, but from my practical experience, I've seen it more in Hispanic communities and in rural white communities, and then African American communities. TMK says, how far as social media is concerned, it gives these types of individuals greater access to their victims. That's a big problem, TMK Media, because these people are hiding under avatars and they're also posing to be younger. They're engaging with kids and posing to be younger than what they are. Particularly when you look, not necessarily as much on YouTube, but definitely when it comes to other social media such as Snapchat, Kick, Instagram. This is a refuge for social deviants to act out their behavior because no one can necessarily verify who they are. They can act like whoever they want to. So social media provides a safe haven for them, unfortunately. Thanks for answering my question. Is there a preferred gender for therapists when working with males? Is there a medication that can help with the sexual impulsivity? Yes, it is. For the most part, the client can say, I don't want to work with males. I don't want to work with females. As far as the perpetrator, it doesn't necessarily matter unless the perpetrator has such a disdain for the opposite sex where it just would not be therapeutically beneficial. Particularly with the victims, most victims, particularly if they're women, they're going to want to be treated by women, not necessarily men. But it all depends. Some just want the help. But in some cases, it's all up to the victim. As the perpetrator, it's up to whether or not they can interact effectively with the opposite sex without becoming angry. Because many of these guys that have issues with women and they engage in these abusive behaviors, they look at women in a very negative light. And I don't think that engaging in therapy with the opposite sex and you look at them from a very flawed perception is going to equal to progress for that person. So you have to assess the appropriateness of that person to participate in therapy with a male or female therapist. It's a little bit of both, Dee, but thanks for the question. Hope I answered it appropriately. And Honeybee said, why guys brag if they slept with teachers? I mean, old heads, but now it's taboo. Didn't it affect them too? Well, the thing about it is, if you're talking about teenage guys, unfortunately, a lot of teenagers don't, particularly those 15, 16, 17 years old. For males, they don't look at it as a sense of being victimized. They look at it from a perspective of they've achieved and it's a sexual conquest, not knowing that they were being exploited. The exploitive aspect of them having sex with an adult is what they're unable to ascertain. They're looking at the fact that, hey, I was a guy and I had sex with an older woman. But this also speaks to the maturity of the teenager. Now, if you look at it from females, there's a double standard. And the reason why there's a double standard is because teenage males can impose their will on adult women. Teenage girls cannot impose their will on an adult male physically. But a teenage male can definitely impose his physical will on a adult woman. That's the difference. But also, we cannot look at things absent of the fact that adult female mentally can probably take advantage and manipulate that young man to doing things sexually or wherever else. So you have to look at all aspects of it. One is the physicality, and the other part is the mental aspects. What's going on, Kev? 504. Appreciate you for coming in. Matter of fact, as far as it being taboo, I mean, guys in this generation, they still brag about if they had sex with teachers. I mean, the teenage guys gonna brag they had sex, period. Okay. So, appreciate the questions. They were very, very stimulating questions. They're good questions that did require me to kind of think about things, and I hope I've given clear-cut answers on that. But this to me was this particular topic here is something that needs to be addressed. Is it deals with paraphilic disorders, pedophilic behavior, because as a community we're overlooking a lot. We're overlooking a lot. And I think that as a community, we need to hold these people accountable for the negative effect that they have on our community. Period. Okay? TMC talked about my dear friends. The one I wrote the song about, her dad was a molester, physical abuse to her spouse and other children. He eventually went to jail for serial rape. With all that, is that part of the deep disorder? Yes, it is. Greatly so. He had more than just pedophilia issues. He probably had some other in-depth psychological issues, multiple things from what you're saying. The fact that he caused harm to so many people. So, with that said, guys, I appreciate you all for being here. I'm going to go ahead and get my butt back to work. Blackbeard the nerd says you should discuss these topics much more and do lives on them. They're very educational, and I will. Before the week is over with, I will be doing another. Video presentation on domestic violence. I will be doing a domestic violence presentation probably Thursday or Friday. Now, the topic that I'm going to discuss, I don't know yet exactly, but what I will say is that it will be definitely a hour and a half to 2 hour presentation. It will be far more in depth with a lot of different things, statistics, and so on, that I'm going to talk about. Domestic violence to me, it's something that resonates a lot in this sector, and so I'm going to talk about more about that. So I appreciate you all, and so I'm going to do that probably Thursday or Friday. I'm going to probably present that, put my thumbnail up early, but Thursday or Friday, it won't take me but about a day to kind of look up the information I want and organize it the way I want so I can present it. But I will be doing that probably Thursday or Friday. Again, guys, I appreciate you all for being here. For anyone that wants to donate to the Janice House, my adult mental health group home, you're more than happy to do so. You can Cash App $Darrell77. Appreciate everybody for being here. Y'all have a great evening. Peace.